Sleep comprises one of the main pillars to a healthy and well lifestyle. Sleep not only plays a role in preventing and reducing risk of chronic illnesses and diseases that plague most of our country, but it also can play a role in the amount of pain that we feel, as we will learn. The CDC describes insufficient sleep as a public health epidemic. Now, two of the most common sleep disorders are sleep apnea and insomnia. Lack of sleep or sleeplessness has been shown to shorten our lifespan, increase hunger sensations by 25%, increase risk for obesity, and other chronic illnesses and diseases. Now, 1 in 10 adults report chronic insomnia. 63% of women and 54% of men report insomnia, and 74% of the population reports at least a few nights per week or more of sleep disturbances or sleeplessness. That is a major problem. So as you can see, sleep is very important. And sleep is when our body and mind actually repairs and rejuvenates itself. And it's actually been said that the time when we sleep is actually when the brain and the body undergoes housekeeping. Because just functioning in everyday life, our everyday tasks of thinking and moving, generates metabolic waste, metabolic byproducts that build up that only get removed while we sleep. And we can see if we're not sleeping properly, these wastes can accumulate and not get dispersed as they should be while we sleep. And this could be an underlying cause of why we see so many issues when we are not getting the recommended amount of sleep. So if we look at this graphic, we can see that heart and blood vessels repair when we sleep. Sleep has a positive effect on our hormones and mood and appetite, as we talked about. Sleep plays a role in stress reduction. We can think better, concentrate better, we feel better when we get a good night's sleep. Sleep boosts our immune system, and in fact, when we're not sleeping, we actually are more prone to illnesses and infections. Our muscles grow when we sleep, and we're able to focus and just feel better when we are getting the proper amount of sleep. And everybody kind of knows this instinctively, you just don't feel right when you're not sleeping. So I mentioned in the previous slide the effects of lack of sleep has on brain health and well-being. But a study actually showed that if you have less than 5 hours per night of sleep for 5 nights in a row, or a full 24 hours of sleeplessness, so you stayed up all night, you receive a 20% cognitive deficit, which is the equivalent of a 0.08 blood alcohol level. So essentially, not sleeping well for 5 days in a row or staying up all night for a full 24 hours puts your brain in a state of almost being intoxicated, which is pretty amazing. Lack of sleep not only affects our brain health, just like the stress response, lack of sleep affects our entire body, our entire system. Lack of sleep puts us at risk for depression, diabetes, obesity. It changes our food cravings. It makes our immune system weak. And there's been a study that showed that just 1 night of poor sleep is enough to shift us into a pro-inflammatory state. Now, if we get 1 night of poor sleep, that may not be a big deal. Our body could compensate and get back to normal. But if we have a chronic sleep disorder like insomnia or sleep apnea where we are not sleeping properly, it's been alluded to that the chronic lack of sleep can contribute to chronic inflammation or an inflammatory state in the body. And that over time, combined with other issues such as lack of stress management, physical inactivity, and a poor diet, all contributing to chronic inflammation, is how sleep can possibly contribute to these other preventable chronic illnesses and diseases. And we now know that the leading cause of death in the United States are from these preventable and manageable diseases and illnesses that have been kind of induced with our lifestyle mainly, such as cardiovascular disease like heart attacks and strokes, even some forms of arthritis, diabetes, and some forms of cancer. Research has shown that there is a direct relationship between sleep and pain. And the relationship is what we call bidirectional, meaning that individuals that are suffering from pain do not sleep very well, and people who do not sleep very well can actually increase their sensitivity to pain. So if you're not sleeping properly, you can actually feel more pain than if you were sleeping properly. We know that there's overlap between the areas in the brain that get affected when you're not sleeping properly and the areas of the brain that are responsible for helping to manage pain naturally, your so-called natural pain medicine cabinet that releases the endorphins and enkephalins. And if we look at this graphic, we could see that lack of sleep actually affects the other vital pillars of an overall health and wellness and well-being lifestyle. Because if you're not sleeping properly, not only can you feel more pain possibly, but you're not going to have the energy because you're not sleeping. So if you don't have energy, you're not likely to work out, which could lead to inactivity. And also, if you're not sleeping properly, we know that you're at risk to feel more stress because there's more stress hormones released, which stress in and of itself can make you more susceptible to feeling more pain and can change appetite, which could lead to obesity and being overweight. And the cycles repeat itself. So sleep and pain and all the other lifestyle factors such as stress, nutrition, and physical activity, they all are intertwined and they all feed and play off of each other. All the lifestyle factors and variables and pain do the same thing. Two key chemicals that are involved in our sleep production and regulation, most of us have heard of, serotonin and melatonin. Now, these chemicals are essential in regulating our normal circadian rhythm, which is kind of like our sleep cycle, when we start to feel tired, when we sleep, and when we actually wake up. So when the sun is up or when it's bright out and we awaken, our body releases serotonin to help wake us up. Now at nighttime, when the sun starts to set and it gets darker, melatonin floods our bloodstream, and that begins to trigger the sleep cycle. And if we look in the graphic in the center, we can see that melatonin is actually made from serotonin, and serotonin is ultimately made from tryptophan in a variety of complex processes that our body generates. Now, when we're under stress and we release cortisol in the bloodstream, the amount of serotonin and melatonin is actually compromised, so you're not making as much. So that's one way that stress affects your sleep. And we said that if you're not sleeping properly, you're going to release more stress hormones. So there's that bidirectional relationship of sleep and stress affects each other. And we could also see that tryptophan, which ultimately makes serotonin and melatonin, we all have heard about the common story about after Thanksgiving when we feel tired. It's because we eat the turkey. The turkey has protein, which breaks down and releases tryptophan, which forms the serotonin and melatonin. So if we're not eating an adequate diet, we can actually be affecting the quality and the amount of sleep we're getting, especially if we're eating sugary processed foods that can make us feel bloated or have an effect on our mood. That can compromise sleep. At the same time, if we have sleep disturbances, we know that we actually increase the insulin and amount of glucose in the bloodstream, and we actually have an increase in hormones that actually can make us eat more, a 25% increase in those hormones. So we can see that what we eat can affect our sleep, but at the same time, the quality of our sleep can affect our food choices. And not only that, we've said in other slides the role that gut health has on the whole process of not only overall health and well-being, but particularly the role of gut health in sleep. So the gut has actually been likened to our second brain, and there's actually more neurons in the gut than in the spinal cord. And the gut and the brain are intimately linked and communicate and coordinate. And we know that there's over 100 trillion microorganisms, what we refer to as the microbiome or microbiota in our GI tract. So the GI tract and the organisms in there, there has to be a balance between good bacteria and bad bacteria. And we know that when the bad bacteria outweighs the good bacteria, that can be a vital factor in overall health and well-being. We know that when the bad bacteria outweighs the good bacteria, that we become more susceptible to inflammation. And we said that inflammation has a link to chronic illness and disease. We know that the gut talks directly to the immune system and to the brain, as well as the brain and immune system talks and communicates to the gut. Now, serotonin is 95% produced in the gut. So you could see that the role that the gut plays in how we sleep, our quality of sleep, as well as sleep affecting gut health. Because as we said, if we are lacking just one night of sleep, we are susceptible to become in an inflammatory state. And the gut has roles in production of other hormones and neurotransmitters needed for mood and sleep, such as GABA. And we said that most of serotonin is produced in the gut, and serotonin is the precursor to melatonin. So the gut has a say in how well we sleep, but a study has shown that just one poor night of sleep can change actually the concentration and the battle between the good bacteria and the bad bacteria. So there again is the relationship that goes both ways between gut health and sleep and gut health. So that's another way that sleep has a direct effect on our overall health and well-being and the production of chronic illness and disease. One way that that may happen, amongst the other ways we talked about, is influencing the amount of and the interaction of the gut bacteria, the good bacteria versus bad bacteria. So we talked a lot about sleep, how important it is, and what could go wrong when we are not sleeping properly. But what is the amount of required sleep that comprises good health? Well, for individuals between 18 and 64 years of age, the average should be between 7 to 9 hours of sleep. And studies have shown that less than 6 hours of sleep puts you at risk for chronic illnesses and diseases, such as diabetes, stroke, Alzheimer's, obesity, cancer. There was actually a study that compared having less than 5 hours sleep compared to more than 7 hours of sleep. And having less than 5 hours of sleep puts you at 42% greater chance of obesity, 69% more likely to have hypertension, 40% more likely to have diabetes, 38% increase in elevated blood lipids, so increased risk of cholesterol, 62% greater risk of stroke, and 152% increase in heart attack. So what a difference 2 hours makes when we're talking about sleep. Let's talk a little bit about some strategies that we maybe could do to help improve our sleep naturally. Now, we said that melatonin is released and triggered as the sun starts to set and it gets darker out. But did you know that blue light, the blue light wave, has the greatest power to switch off the production of melatonin? Now, if you think about it, most of us, when we lay in bed at night, we're either on our computer, we're on our phone, or we're watching TV, or we may have the lights on or the lamps on. Something simple that we could do is avoid that quote-unquote blue light stimulation. And one way we could do that, besides just turning off those electronic devices, many things such as the Kindle or phones, you could actually control, and there's an option to have the warm light setting. So instead of that bright blue light, you'll notice like an orangish, brownish setting to the light or the tone of the light. And actually, a lot of lamps have that setting too. A lot of lamps have multiple settings, not only that can adjust the brightness, um, how bright the light is shining, but the type of light that's emanating to a more softer light. And by getting rid of that blue light excessive stimulation, we can have an effect on the production of melatonin, which could make us sleep better. Another option to consider is using blackout curtains or blinds that are completely blocking out any light. I've had patients say that their window is right in front of a bright street light or across from a store that has bright lights, or a lot of patients are even involved in police or military where they're working overnight and they're sleeping during the day. So blocking out as much light as you possibly can, so melatonin will naturally be stimulated and reinforced in the bloodstream as it's normally triggered when the sun starts to set and it is getting dark out, instead of interfering with that production by either the blue light stimulation or light coming in from an external source. So when we're sleeping, there's actually a drop in body temperature that happens, and metabolic activity decreases as we sleep. So a simple recommendation would be to make sure you're sleeping in a somewhat cool environment. Set the thermostat anywhere between 64 degrees to 66 degrees, and make sure that we're not having an environment that's too hot, because that could actually increase metabolic activity and can interfere with sleep. Also, consider taking just warm showers or maybe even cool showers, because even though a nice hot shower can actually be relaxing, it's stimulating and it can increase metabolic activity and increase heat. And as we said, when we sleep, there's a drop in body temperature and metabolic activity is decreasing. So we don't want to do the opposite of that. We want to kind of reinforce the natural direction that the body is going in. And this is really interesting, the effect of alcohol on sleep, because many people think that drinking alcohol helps put them in a good quality sleep, or they feel like alcohol makes them drowsy and sleepy, so it must help their quality of sleep. But studies have shown that alcohol actually reduces the quality of sleep and can increase your heart rate and you get less sleep. So alcohol is a nervous system depressant. It interferes with your sleep cycles. So while you may be unconscious for 7, 8 to 10 hours, you actually have less REM sleep, which is the repairing sleep, the deep sleep that we need. And the studies have shown that even though you are unconscious, you have frequent what's called microarousals. So you're not getting anywhere near that quality sleep that you need. So don't be confused by thinking just because you're unconscious for 7 to 10 hours that the quality of the sleep that you need for the reparative sleep is actually being helped by consuming alcohol. I think most of us understand the effects that caffeine can have on sleep. But what's interesting is most people don't know that caffeine have a half-life of 5 to 7 hours. What that means is after you consume any amount of caffeine, there's still 50% of the concentration of caffeine in your bloodstream 5 to 7 hours later. So if you have a couple cups of coffee throughout the day, the last one being maybe 4 o'clock, 7 hours later at maybe 11 o'clock at night, you still have half of that amount of caffeine in your bloodstream. So if you drink 240 milligrams of coffee, at 11 o'clock at night, you will still have 120 milligrams of caffeine in your bloodstream. So besides light control and altering the temperature in your room and avoiding alcohol and caffeine, something else we could consider is consider reading or journaling. They have historically been referred to as calming and inducing a relaxing state and helping us sleep. Also consider the other pillars of health and how they could be affecting your sleep like we talked about. Consider improving your diet, exercising more. That's been known to help you sleep. And again, when you sleep and you feel good, you're more likely to exercise because you're rested and recovered. Like we talked about, consider the role that stress can be playing in your quality of sleep, and consider stress reduction. Some experts recommend only using the bedroom for sleeping and not working. And they even suggest not even having a TV in the room, just because psychologically, then you know once you go into your bedroom, there's nothing there to distract you. And especially besides the light, you don't feel like you have to be working or there's any kind of distractions. Avoid excessive daytime napping. Napping can be beneficial, but try to keep it to anywhere between 20, no more than 30 minutes. And in this day and age of technology, there are some great sleep trackers that help to give you an idea about the quality of sleep you're getting, because again, as I said, we don't necessarily know the quality of sleep that we are getting. Sometimes we think if we're unconscious for 8 hours, we had a great sleep, but that may not be the case. And there's also some great apps that are out there that help to induce sleep that you can download and possibly have access to. There are a variety of supplements that are on the market today that may aid in sleep to complement the other strategies that we talked about. As a standard health requirement, I always suggest people consume multivitamins, omega-3 fish oils, a B complex, and magnesium. But in addition to that, there are melatonin supplements. There's precursor supplements to melatonin, such as 5-HTP. There's GABA, which we know is a neurotransmitter that's calming and relaxing. There's also a variety of teas that have herbs and other kind of formulas in there that are geared towards sleep improvement. There's an example would be the Sleepy Time tea. There's capsules that you could actually take of individual herbs such as valerian root or chamomile. The list goes on and on as far as herbs go. One of my favorite supplements is theanine. Now that's an amino acid that is found in green tea, and it's been known to be very calming for the nervous system. And it's actually been referred to as a natural Xanax. I always recommend patients discuss with their healthcare provider, their doctor, their primary physician. If you are taking any medication, and even if you're not, have a discussion with your primary care physician about what supplements may be appropriate for you and your needs, especially if you are on medication. This way there is no negative interaction between the sleep supplement and your medication. There are some instances where patients have tried some or all of these options and they still are not sleeping properly. And being that we discussed the vital role that sleep has on health, well-being, and possibly pain control, it is an area that needs to be addressed. And you could have an underlying sleep disorder, like we said, such as insomnia or apnea, that will not respond to some of these suggestions and tips. So in that case, we recommend having a consultation with a sleep expert to maybe do a sleep study so you can diagnose if you have any of these sleep disturbances or sleep illnesses. And in that case, you may need some sleep medication, either temporarily or as like a maintenance suggestion. And we also recommend to have your level of hormones checked, because as we said in previous slides, your hormone levels have an effect on the quality of sleep. So for some patients, your hormone levels may be not at their optimal level, and that may be worth looking into. So sleep is just one component in the overall healthy lifestyle and living a lifestyle of fitness and wellness. Other components like we talked about are diet, physical activity, and stress reduction. All of these come together, they feed off each other, and they could enhance each other or negatively affect each other.